Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today I'd like to talk to you about gestational hypertension or high blood pressure pregnancy at home. And what do I mean by that? Well, you may find that you've been told that you have high blood pressure pregnancy, and generally speaking, we are now able to manage this condition at home with close follow-up in the office and a general plan of getting you delivered approximately at 37 weeks. Now, there's a lot of details to this that are really, they depend on your own specific circumstance. So this is just an overview to give you some of the precautions to watch for. So, high blood pressure of pregnancy or gestational hypertension can occur after 20 weeks pregnant, but more commonly occurs in the third trimester. And generally speaking, we found that with monitoring and monitoring your labs and the baby's condition and the fluid around the baby, that we're able to get you safely to 37 weeks. Now, if your blood pressure gets too high or you have some abnormal labs, then you might need to be delivered sooner than that. But for now, I'm just talking about some of the things that you need to watch for when you're at home if you have gestational hypertension. And one of those is you need to reduce your activity. We don't recommend bed rest anymore, but it's not time to be changing a tire or to be doing double duty. Depending on your condition, we often will take you out of work, especially if it's a lot of physical work. And that way you can eat healthy and monitor your own condition. You want to try to get some rest, take some naps. What's most important for you to watch for is to watch for headaches. Near the end of the pregnancy, it's very difficult to sleep, to get comfortable, and so, excuse me, sometimes some headaches are common. I encourage you to take some Tylenol early on, but if the headache doesn't go away, or if it's really severe, then that's the time that you need to be seen. Now, everybody has different instructions. You need to discuss this with your doctor, but generally what I recommend for my patients is don't call, go to labor and delivery, get seen. And the reason is that if you call in, you get a receptionist, or you get delayed, or you get the wrong answer. If somebody doesn't have your information, they might tell you to do some things. If you've been told that you have gestational hypertension and you have a really bad headache, then we want you to be seen. So we want you to come in, preferably have someone to drive you in. You may be instructed to monitor your blood pressures at home. You may not be. You might get some numbers or cutoffs. That needs to be tailored by your physician, but generally if your pressures are getting too high, that's when it's time to come in as well. We also want you to pay attention to how the baby's moving. If the baby's moving fine, you're set. But there are times when you get busy, or times when baby sleeps, when the baby doesn't move as well. And so that's when we recommend kick counts, which I've gone over before, but I'll go over now. Basically, get something to eat, something to drink, lie on your left side, put your hands on your belly. You can lie in other positions too, that's just most convenient. Turn off the TV, turn off your phone, so that you're focusing with your hands on your belly. Count kicks and movements. As soon as you felt 4, the baby's fine. If an hour goes by and you haven't felt 4, then do another hour, and you need to get 10 kicks in 2 hours or 4 kicks in an hour. There are some variations to these guidelines or recommendations, so discuss it with your physician, but that's a good frame of reference. If you don't meet those criteria, if you don't get that amount of kicks in that amount of time to be seen, again, you might get a different recommendation from your physician. I don't recommend that you call. I recommend that you go in, because we can't assess you through the phone, and you've already done those, the kick counts, and if you haven't met them, it's time to come in and get checked out, put you on monitor so we can see how the baby's doing. Okay? You'll be seen weekly or sometimes twice a week, depending on your personal condition. They'll follow your blood pressures, they'll follow some blood tests. They might do something called a non-stress test, where they follow the baby's heart rate and look for a specific tracing pattern called a reactive non-stress test, or reactive NST. That assures us on the baby's well-being for a certain number of days. And also they might do a fluid index that's called an AFI, an ultrasound. Might also at some point do a growth ultrasound to see how the baby's growing. So those are some of the general baseline instructions. You definitely should get these personalized to your specific condition and go over it. But I also find that with all that's going on, sometimes you forget the instructions, and so this little video might be a nice refresher for you. I hope you found it useful, and I hope things go well for your pregnancy. Be sure and talk to your team for tailored information for you. Thank you.